Will my vision really improve after this eye injection treatment? Why do I need to take these eye injections again and again? Will this ever stop? Hi, I'm Dr. Shrutika Junagare-Kankriya, a retina expert and cataract surgeon at Asian Eye Hospital, Pune. Eye injections, anti-VEGF injections, intravitreal injections are all the same. And yes, these injections have revolutionized the retinal disease treatment, especially in retinal disease which include retinal swelling and retinal bleeding. So what are the diseases which cause retinal swelling and retinal bleeding? The most common cause is diabetic retinopathy. The next common cause is age-related macular degeneration, AMD, or retinal stroke, which is known as retinal vein occlusion, which can be central or branch, that is BRVO or CRVO. Most of these patients taking injections get overwhelmed by the number of injections they are required. Repeated visits to the retina consultant, repeated OCT scans, repeated injections, going repeatedly under the microscope to get those injection shots can be really frustrating and overwhelming. Now let's understand, why do we have to give these injections again and again? So as long as the retinal disease is active, meaning there is swelling in the retina and there is bleeding in the retina, we need to keep taking these injections until the disease completely dies out. For example, if somebody has a cancer, we keep treating the cancer until the cancer is completely eliminated from your body. Just like that, we have to keep giving these injections until the AMD disease completely dies out or the diabetic retinopathy completely resolves into a dry diabetic retinopathy. Like any drug in the body or oral medication we take for any disease has a limited duration of action. These injections also have a limited duration of action in your body. In fact, I keep telling my patient, fortunately these injections at least work for 4 to 6 weeks on an average, even for duration of 3 months. We should feel fortunate enough to have these injections working for such long durations. Otherwise, medicines like insulin work only for a short while, and patients on insulin treatment have to take these injections almost twice or thrice in a day. I always tell my patient, let's look at the filled glass rather than the empty glass and be happy enough to realize that at least these injections are there which resolves your disease. 20 years back, this treatment of injections didn't exist, and patients having such retinal disease had no option but to suffer vision loss, which can even lead to permanent vision loss and blindness. Retina is an extremely delicate organ and literally extension of the brain. It is made up of very delicate neurons and nerve fiber cells. For example, if you get injury anywhere on your skin, the wound will heal because the skin cells can regenerate. But retinal cells are very specific because they are made up of neurons and specific neurons. These neurons cannot regenerate. So it is extremely important to not allow that retinal swelling to permanently damage these retinal cells as they cannot regenerate. Hence, we have to take these injections repeatedly and very frequently to prevent retinal swelling and subsequent retinal cell damage, which can eventually lead to permanent vision loss. Hence, patience and sincerity and the discipline of visiting your doctor for follow-up visits to get those scans and injections is extremely crucial for long-term vision restoration in patients suffering from retinal diseases. Most of these diseases would require you to take injections ranging from 2 to 5 years. In the initial 1 or 2 years, the number of injections required are more, but eventually the frequency and the number of injections reduces. Now we have new injections like brolucizumab and faricimab, where the duration of action of these injections is from 3 to 4 months. This will definitely reduce the frequency of injection required. The effect of injection is noticed as early as 1 week after giving the injection and may last up to 4 weeks to 12 weeks depending upon the injection you choose. I have so many patients who have taken 20 to 30 injections per eye and definitely restored the vision. And of course, the fact they are taking the injection because the injections help. I have a patient who is suffering from a specific AMD which is called PCV. AMD is the age-related macular degeneration. And this patient has 2 brothers and 1 sister who have lost vision because of this deadly PCV disease. This patient of mine has taken 31 injections in the last 8 years and has successfully restored his vision. This was possible because he had trust in the treatment, he was extremely sincere with follow-ups and taking injections. Taking injections was a priority because he knew what happened with his siblings can happen with him as well. I hope you now understand the importance of taking these injections regularly, definite clear benefits of taking the injections because they do work. Please like, share and subscribe for more tips and clear information about retinal diseases and eye disease.